Hey Maya, how are you? Good to see
I'm just superior right now.
I love it. So you are 1 week post-treatment,
Yes, today.
and I know you had some fabulous results right afterward, but tell me a little bit about what's happened since you left the center and now back at home.
Well, what's interesting is when I did the reset on a back-to-back, it was a Tuesday, Wednesday. Then I had the privilege of working with you and people there and teaching some things. So I was on the move a lot. And when I'm that busy, it's only at night that I get to go, okay, how's my body feel? How am I feeling right now? And of course, I told you that the first thing I noticed was that I got my very first full night's sleep with restorative rest. I got my first night in 60 years after the left side was done.
That's a great.
So, of course, I get on a plane, I come home, but I also notice on the plane a very funny story. I mean, it should have probably been a bad thing, but it turned out to be a good thing. Uh, I'm in New York and I'm getting on the plane. Oh, we're going into New York, and I'm just as relaxed as can be. And travel is not a relaxing situation. And I'm very relaxed. And they say, "Oh, put your seatbelt on. We've got 5 more minutes, and we're going to be landing." And we'll be in New York and blah blah blah. So normally I would have gone, okay, get all my stuff together. Do I have my check bag thing? And I would get busy to get ready to deplane. And I didn't. I just sat there and I just kind of closed my eyes and I fell asleep. I fell I do not fall asleep in public because I'm afraid I'm going to drool or something. And so I fall asleep sitting up, and just as they are going down and they hit that tarmac, and I come out of my chair like a cannonball, which the first thing I thought was, oh my God, does this wreck my reset? Because I felt like I just been hit by a car. I was fine. I'm deplaning, thinking to myself, who falls asleep as you're about to land somewhere? So that was sort of going on in my mind. Had to take another plane, get home, great night's sleep. And now I'm in instantly with 50 hours of clients.
So really quickly, remind everybody how old you are because you look like you're 45, but
Oh,
tell us how old
you
you are.
keep winding it back. I just literally just had my 74th birthday. And of
Okay.
course, as a trauma specialist, I wondered, even though I've sent so many people to get reset, I thought, I'm probably got more adaptive neural pathway shut down stuff that has just become my life. And at 74, what can I really expect? What can I really expect? So I was just going to be happy with good sleep. I
Mm.
mean, that was a miracle all by itself. One of the prices of hypervigilance is that you grow into a awareness that becomes normal, is that you believe that you are always being watched for your behavior and for your presentation, or for your being, productive and acceptable, or meeting people's expectations. And it's just there. So would I ever go out in public with no makeup? Not on your life. Because there's a belief that you have to sort of be perfect all the time. You have to be perfect with clients. You have to be perfect in your presentation. You have to be a perfect friend. You have to be perfect. So imperfection from hypervigilance is just not very tolerated. So the other thing is you overextend into doing so much to please so many people to get so much done that I didn't realize that my life was a hurried life.
Mm.
It was I walk around with my appointment book. I'm to the minute. I hardly leave time to pee. I'm basically here to here to here to meeting to person to write up a report to now I have to put it in. I have to wash my hair today. Okay. suddenly I'm walking at a pace, I'm moving at a pace, I'm coming to my day with none of it. And it took me 3 days to go, what is going on here? What I feel different. And I realized I was not in a hurry to do anything, especially please another human being.
Mm.
It was like, take me for who I am. If you like me, great. If you don't like me, that's okay too. And my investment in having to save every client I have, I've got to make sure their life is stellar by the time they finish working with me. I'm like, nope, that's their job. I'm just going to give them the opportunity. And I'm watching all this go on. And of course, Kelly, the thing at this age is that you kind of go like with sleep. You say, am I supposed to have felt like this all the time? And
I had
then you
another
have,
patient say the same thing. Is this what you get to feel like every day?
and there is a moment of regret. It's like, oh my God, what different things would I have done if I had felt like this at 40? And what things could I have chosen that I didn't because I was afraid, or I thought people who had expectations of me doing something else, or but that didn't last long because I know that I didn't have the choice of the reset 40 years ago, 30 years ago, 20 years ago. It's like, thank you, God. The gift is now. Now, what am I going to do with this gift? Now, how am I going to use, and what I'm going to take everything I've just said and put it inside of is now, what am I going to do because I embody a self that has no anxiety? Because everything I just mentioned, hurried expectations, is all about walking around life feeling this generalized sense of anxiousness. But after decades, you don't even recognize it as anxious. It's just normal.
Right. You think it's who you are, right?
Yeah.
How life
And
is supposed to be.
when it is not there, suddenly you're smelling roses and you haven't looked at your watch. It is a starkly shocking experience at my age. Starkly shocking. And so it's also, remember when I did the reset, I did which I do feel is a very big asset to getting the reset, which is getting twilight sedation.
Mm-hmm.
Is that I didn't amass as much anxiety about an unknown procedure and have to deal with the adrenaline of that. And as Dr. Lauer said, I was smiling during the procedure. I was laughing after the procedure. And I did it both days. And I thought, well, that's just because I was probably relieved. I was okay or something. That has maintained itself. It's a level of, it is as if you think about when anyone, especially with childhood trauma, their vagus nerve goes into hyperdrive and they move into hypervigilance, like where's the alcoholic father and da da da, is there goes childhood wonder and awe. It is gone at that point. You don't get to have childhood wonder and awe when you are a 5-year-old waiting for something bad to happen.
Right.
When we reset the vagus nerve to original settings, I just realized this as I'm talking to you, we reset it to the potential of awe and wonder.
Hmm.
And I have felt that level. It's what I sort of felt after the reset. I feel just joyful, even though life is hard and the world is precarious and bad things are happening. I can say, yes, that's true. And then all this other truth is also as true, which is it is a magical world we live in. And returning to that joy that I thought that I really thought I had a larger measure of joy as an adult than most. But in this case, I was wrong about that. I feel it completely differently now.
Well, it's really funny because I was listening to a podcast that I did a couple of months ago, but it just came out. I did it with another doctor. And when I was listening to myself, I was like, who is that calm person? Like every other podcast I've been on, and obviously, I think I told you I got my treatment for menopause, but I yes, I don't have hot flashes anymore, but what I also have is this overwhelming like level of concentration, focus, calmness, like the same thing you were saying, like it's okay. Like I'm gonna get to it. It's gonna be okay. We know it's there. We know we're gonna get it done. But instead of that tensious,
Right.
anxious
The push.
energy, the push. But I was listening to myself on the podcast and I was like, wow, I even sound calm. Like, and I mean, I don't know, it was just so different for me, but I didn't see that until I heard it. But I
Yeah.
did that like a couple months ago,
Wow. Yeah, it's a very, I think also the proof of the pudding is also the people who know us the best, which are usually our children. And, waiting to see, do they notice something I don't even see? Do they see me being different that maybe I didn't even think I needed to be different about? I haven't gotten to be around both my kids enough to amass that feedback, but, I think sometimes we don't even notice a new shift or a new behavior until someone says, wow, you feel really blah, blah. You feel calm, you feel something. And you go, oh, yeah, you're right. I do. So awesome.
Awesome.
That's awesome. So
So what
if
do
I
you
were,
say to people, obviously a lot of skepticism of age and things like that, I'm too old, I shouldn't do this. It's for, people really depressed or really anxious or whatever. But what's your, I mean, obviously you deal with a lot of trauma and a lot of depression and anxiety and so forth in your role. But I mean, who in your mind is the right person for this?
uh, in general, and just all the demographics?
Yeah.
Well, I think it was Gabor Mate who has been sort of the father of the big trauma conversation over the last decade, understanding trauma at a different level, even though understanding trauma as biological is it's a newer proven, statistically proven reference to trauma, is that this is not a psychological issue. This is a biological switch that is running your show. Gabor said something like, there is no one that's not traumatized. There is no one, especially if you factor in what I work with, which is the epigenetic factor of how do we inherit the trauma from the people who came before us? How does our DNA get imprinted with trauma from a grandparent who died in the Irish potato famine? And now I have an eating disorder, but I don't understand why. Is that we carry trauma for the ages. And so at one level or another, every person, I think, can benefit from this. Yes, the stark examples of the military or people who have been in what I call catastrophic trauma, of like watching someone die or, a life-threatening, being blown up on the battlefield, etc. But I feel it's equally as traumatizing to be in a system, family system, religious system, military system that is constantly shaming someone. That is trauma as well. So basically, I guess I'd say I don't know anyone that would not benefit from it at all.
Right.
Because complex trauma, the left side, and specifically overt trauma like being hit by a car or, life-threatening illness or, being beat up and mugged in New York City or something like that, is the right side. And yet all of us, I suspect, could reference not only the trauma, but we could, if we spend enough time, think about how that trauma has changed our choices in life. And so for those who are my age, I say, oh, it's just a brand new adventure. I can't tell you how it's going to go, but they've got nothing to lose. Let's just see. And that's what I felt when I came. I said, I've got nothing to lose to try this. If I get good sleep, great. If I get more, what an amazing thing. But you have to be willing to encounter the unknown with the reset. And a lot of times with trauma, the unknown is what we avoid. because we can't control the unknown. And this is that leap. Doing the reset is a leap that is well worth moving into the unknown, because I do believe the body responds, and how it's going to respond for one person over another is going to be very different. But I just think everybody could use it. Everybody could use it.
And I know you have a actual patient behind us here waiting to get on the phone, but really fast, I just want to say, when you came and I met you originally over Zoom, and we started talking, and you had already been referring, patients in to get the reset. But when you did that, you had said, I should probably do it too, since I actually have been referring patients in to see what the experience is like, what your center's like, that type of thing. But you, in all circumstances, from an outside view looking in, would be somebody I would say probably doesn't qualify, right? Because you generally are successful in your life. You get through your day to day. You are, like you said, a pretty happy person. But the changes that I can even see in your stature, in the way you carry yourself, if I could go back to a meeting from 2 months ago to today, is just a sense of peace and calmness. And I'm just thrilled that we can see that in you. And
that feedback is it's immeasurably helpful. I think the last thing I'll say really quickly is, most everyone I have worked with all refer at least to one thing every single time. And they refer to what I call the presence of a pause. I'm referring to it as a pause, meaning suddenly you are less anxious enough to slow down, to be more present in a moment. But if something comes at you, if a moment happens, if there's a conflict, if someone's angry, if you have a crisis of some sort, it's not a 0 to 60 response anymore. It's you wait. There's this room between you and the moment. And in that moment, now you have 10 different things you could choose to do versus your knee-jerk crisis response. You go, I could do this, I could say nothing, And what I've learned about what has always been the potential choices to make in those moments, that I've been living in a moment that's about this wide. Pausing and making new decisions is so much easier.
Yeah.
So much easier.
I've heard that from so many people. One person, we don't have time to go into it, but literally thinks it saved her life because a guy pulled a gun on her, and she normally would have been like really intense and like fired back. And she said, I probably would have been shot had I not been so calm and been able to talk him down. And so you just never know when you don't need to go 0 to 60 from 9 to 10 in 2 seconds. You should be able to count to 10 and slowly process what's happening. So thank you so much, Maya, I know you have a patient right behind us, but we appreciate you so much and all you do and the people that you serve and the time that you take. I mean, you haven't given up, right? You're 74.
No, not in the least. I have a whole nother life to live now. And yes, I'm more than happy to give my perspective at any point. You guys have been life-changing. I am deeply grateful.
Thank you so much.
All right. I'll talk to you later.